Our next witness is giving evidence anonymously. And because of that, in order to protect her anonymity, I'm going to make what is known as a restriction order, which is a legal order. Let me explain something of that so that everyone understands its effect. The witness will be known as Mrs. E. The purpose of protecting anonymity is because people are entitled, generally speaking, to not have their name put out there if they do not wish that to happen for good reason. It might be a good reason that it is more important that everyone of the public should know the name and identity, and that may apply to some people who would otherwise wish anonymity. But for those who are infected and affected, that doesn't normally apply. And so I'm going to make an order which ensures that nobody may say anything by any means, by writing it, WhatsApping it, tweeting it, etc., to cause anyone else to identify the person who will be giving evidence. Mrs. E has the courage to give evidence before us. She'll sit there, you can see her, but you must not reveal her identity. To do so would actually be quite a serious matter. Let me read out what the order says. That's part of the legal process, and excuse me if it may be a bit legalistic for some. In exercise of the power to make such an order, which I have, it is ordered that 1. The name and address of witness W0096, that means in this room Mrs. E, and any other identifying information, such as the witness's image or a description of their appearance, cannot be disclosed or published in any form unless express permission is given by the chair of the inquiry or the solicitor to the inquiry acting on my behalf. The witness must be referred to only as Mrs. E. In fact, I've got it wrong. It's Ms. E. I do apologise. This order remains in force for the duration of the inquiry and at all times thereafter, unless otherwise ordered. And I may vary or revoke the order by making a further order during the course of the inquiry. The result is that Mrs. E obviously won't have her image live screened. She's content that what she says should be live streamed, but nothing you may say may otherwise identify her. May we have Ms. E, please?
Lizzie, your full name is known to the inquiry. Please take the book in your raised hand and repeat after me. I swear by Almighty God.
I swear by Almighty God.
That the evidence I shall give.
That the evidence that I shall give.
Shall be the truth.
Shall be the truth.
The whole truth.
The whole truth.
And nothing but the truth.
And nothing but the truth. Thank you.
Lizzie, you have and were diagnosed as a child as having von Willebrand's disease.
Yes, that's right.
And can you tell us a little about what that condition is?
Von Willebrand's disease is basically like haemophilia, except it's just not as bad. In women, it means prolonged bleeding in menstrual cycles, and we can bruise easily. Getting the teeth out, we would bleed considerably more, Our blood basically doesn't clot as quick.
And in 1989, when you were about 17, you had your tonsils removed.
That's correct.
And there was you hemorrhaged afterwards and returned to hospital. What can you recall about that?
Approximately 2 weeks after I had my tonsils out, I hemorrhaged and had to be taken back in again, at which point I received cryoprecipitate.
Now, you've described in your statement how your parents agreed to you being given cryoprecipitate as a last resort. And you've said in your statement that you told the hospital that you'd receive cryo only if it was really needed, if it was for life-threatening reasons. Is that right?
That's correct, but I was assured that it was quite safe to take.
Well, that's what I wanted to ask you. What, if any, information do you recall being given to you or to your parents about the risks, if any, associated with being given cryoprecipitate in 1989 when you had this operation?
Very little. I was just basically told that it was okay to use. It was fine.
What you've said in your statement is, looking back now, you think that the cryoprecipitate was given to you too easily. What makes you say that?
I basically think that they just give it to you just to get you basically out and free up a bed.
Now, you began to feel unwell a matter of months after this procedure and the receipt of the cryoprecipitate. Is that right?
That's correct, yes.
And can you tell us about the kind of symptoms you began to experience?
Tiredness, fatigue, cold, having to take days off from my work as holiday leave, basically just feeling very, very unwell.
Now, you have understood that receipt of cryoprecipitate in 1989 to be the cause of the hepatitis C that you were subsequently diagnosed with. And can we just have up on screen, please, a document? It's 0096002, please. Okay, and it's a communication between Dr. Main and a GP. And if we just have the first paragraph, last sentence, highlighted, it says that you received cryoprecipitate some years ago. I am sure this is the cause of hepatitis C. But you've said in your statement that you now think, having seen some of your medical records, that you might have been infected prior to 1989.
Yes, whenever I retained my GP notes, I happened to read a letter that Dr. Main had sent to my GP at that time, stating back in 87 that I had hepatitis C.
Okay, well, let's have a look, shall we, at a document. It's 0096003. And this is part of a letter from Dr. Main to another doctor. And if we just look at the paragraph numbered 2, it says this: due to receiving blood products prior to 1987, she is positive for hepatitis C, but no other virus. And that letter's dated, for the record, 28th of June 1994. So is that has led you to think that you may have received some form of blood products prior to the episode in 1989 when you were given cryoprecipitate?
Yes, that's correct.
And can you assist us with what other medical interventions you had prior to the surgery in 1989 where you might have been given blood products?
I was admitted into children's a couple of times with stomach pains, which they assumed was, we thought was appendicitis. And I had been given treatment, and then the pain disappeared.
So do you know whether you were given blood products from your own recollection or your family's recollection at that time?
I was told I was getting ready for theatre.
And that's all that you're aware of?
Yes.
Now, having begun to feel unwell in about 1989, in the way that you've described, you underwent various investigations and you were diagnosed with pernicious anemia and with ME.
Yes, that's correct.
But there came a point, you've said in your witness statement it was in 1993, where you had a conversation with Dr. Main where she said something different to you. What was that?
I was going up for my usual appointment in haematology, and in the corridor of the Royal Victoria Hospital, she was coming out of the ward as my mother and myself was walking up in, and she stopped us and she says, "Well, how are you feeling now?" And I said, "I'm still feeling very tired, still don't feel great. I feel like there's something really wrong." And she replied was, "If it's not your ME, it must be your hepatitis C." And this was the first that I had any knowledge that I was hepatitis C.
And it's right, I should record that Dr. Main has indicated she's no recollection of that conversation. Did you know at the point at which you had that conversation, or you were told that you had hepatitis C, did you know that you had been tested for hepatitis C?
No.
What, if any, information were you given, either then or later, about the nature of hepatitis C and how it might affect you?
It was a little virus, nothing to worry about.
Now, how, in fact, did the hepatitis C virus impact upon you in terms of physical and other symptoms?
The impact of hepatitis C affected me greatly where my life was concerned. I had to give up work, and my marriage broke down through cause of it, and my health deteriorated quite a bit.
You've described in your statement how throughout your life you've had numerous health problems, and the diagnoses that you've had include chronic fibromyalgia, chronic fatigue syndrome, prolonged bleeding, arthritis, gynecological difficulties and others. And one of the questions you're unclear about is the link that there might be between those conditions and the hepatitis C or the treatment that you subsequently received for it. Is that right?
That's right, yes.
And have you asked any of those who've been involved in caring for you to investigate or tell you if there is a link?
I did ask, was ME or fibromyalgia related to it, and I was told that they didn't know what the outcomes were of it.
Now, in your witness statement, you've said that in the early 1990s, you were asked to be, and this is your term in your statement, a guinea pig for interferon, a new drug treatment.
That's correct.
And I wondered if we could look at one further document, Mazzie. It's 0096007, please. And we can see there, it's a letter from Dr. Main to a Dr. Simpson, and it says this: Dr. Greer and myself had a prolonged discussion on the 4th of October 1994 regarding the possibilities of giving her a trial treatment with alpha interferon to cope with the hepatitis C infection. During last week, I had the opportunity to discuss hepatitis C infection with a world expert, Professor Eric Preston. Despite the liver function tests not being grossly abnormal, Professor Preston thought it would be appropriate and worthwhile to have a trial of alpha interferon to see if this improves her symptoms of intense fatigue, etc., etc. And then she goes on to say she'd given you various pamphlets and awaited the results of a discussion between yourself, your then husband, and your mother. Now, is that what you mean when you talk about being a guinea pig, that this was the early days of interferon?
Yes, Dr. Main had informed me it was a trial stage, and would I be happy enough to take part in it?
In fact, you decided to not participate then because you wanted to start a family.
I asked her what would the side effects of it be. Would I be still okay to have a child afterwards? How would it affect me in that way? And I was told they didn't know. So I said in that case I wanted to hold back starting it until I had a baby.
And you did have your first child in 1995, and your witness statement relates the circumstances in which you were treated in the Royal Victoria Hospital at that time. What can you tell us about that?
I was taken into the Royal Maternity. I was given my own side ward and my own bathroom with hazard, big bold writing on yellow signs placed on the doors, and I wasn't allowed to eat with the other ladies. I had to eat and stay in my room, basically, and do everything I had to do in there. All my bedding was put into hazard bags. All my son's beddings was put into hazard bags, even though at this point he hadn't been tested. And then specifically one night I heard him crying. All the children were always put into the nursery at night time. And I looked out of my door and my son was in the corridor. And when I asked why he was in the corridor, I was told he had a slight cough, which he didn't have.
And you said in your statement that at this point in time, all you'd been told about your hepatitis C diagnosis was that it was a little virus with nothing to worry about. So seeing my son being treated like this was very upsetting to me.
Very much so.
Now, you have described in your statement being made to feel an outcast when you went to receive dental treatment.
Yes, whenever we went to the dentist, as the previous witness this morning described, we were always kept to last, always taken into a separate room, which was covered in plastic from top to bottom, and then everyone came in, gowned up, masked, gloves, and all the utensils was all covered and put into hazard boxes whenever they were finished with them, basically.
Now, you did embark upon, after you'd had your first child, you did embark upon a course of interferon treatment.
Yes, I did.
At some point in the mid-1990s. And you've described it as you started to inject the dry interferon into your stomach 3 times a week for 6 months.
Yes.
To no avail. It didn't clear the virus.
By that stage, I was diagnosed. I had a liver biopsy done, and I was diagnosed with chronic hepatitis. Yes, it had no appeal on it whatsoever.
And you've said in your statement, at this point, I was told I would never see my 30th birthday.
Yes.
What can you recall about that?
At that point, I asked my husband at that time to go out and purchase a camcorder for me so that I could make a video for my son. For whenever he was older, he would know who I was.
You've said in your statement in 1998 or thereabouts, you started a second course of treatment, interferon and ribavirin, and again that involved injecting yourself 3 times a week and taking 6 tablets a day for 6 months.
Yes, that's correct.
Did you experience any side effects from that course of treatment?
Very much so. I basically didn't have any life at all. I would be lying on the sofa with blankets around me, a fire raging, even though it was in the middle of the summer, constantly cold. To this day, still feel the cold, very much so, and no appetite, loss of weight, and all of that took a toll on my first marriage, which led to it.
And you've said this in your statement. During this time, the treatment took a lot out of me. I became a recluse. I lost friends, had no social life, no energy, spent most of my days with my head stuck in the toilet being sick, trembling under a blanket due to extreme cold and fatigue.
That's correct.
And you had to rely upon close family members to help you with, both in terms of looking after yourself and looking after your child.
Very much so. I had to lean very strongly on my mum and dad.
And you've said, as you've just explained in your oral evidence, that was the end of your first marriage. And you also stopped telling people around this time that you had hepatitis C. Why was that?
Because of the stigma that came with it. You could see people looking at you whenever you would say, I've got hepatitis C, but it's nothing to worry about, it's just a wee virus, is the way that I would have said it. And you could see them looking at you and they would say to you, is that not the same as AIDS? And then you were having to explain yourself every time and say, no, you can't catch it the same way, it's not the same as that. And you got that no matter where you went. So I just started to say that I had a liver problem, which led to people then turning around and accusing me of being an alcoholic.
Now, in around 2004, you were told that the virus was now in a dormant state, that you'd cleared it or the levels had become undetectable. Is that right?
Yes, it was. That took me to the side room to give me the great news that she was all thrilled to tell me that they had cured me.
And you've said in your statement, I thought I would get my life back and that I could finally make some plans. How did your health improve or alter after that?
No, my health basically has just gone from, got worse and worse over the years. And I'm still no wiser to what it's all came down to. Was it down to the treatment? Was it down to the hepatitis C? I'm basically none the wiser.
At some point, you've estimated in your statement, it may have been around 2006, you received a letter about the risk of VCJD. What can you recall about that letter and its effect on you?
Yes, I received that letter and I just thought, not again. I can't take any more of this. I've just been told that I'm all clear of hepatitis C. Now I'm having to declare this. It just seemed to get worse and worse. Depression, wondering what was going to come through the door basically next.
Did you receive any further information about VCJD, or was it simply the letter drawing attention to the possible public health risks?
It was just simply the letter drawing the attention and to notify hospitals if I was going to have any treatment or anything done that I was at risk. Now,
you remarried in 2010 and you had your second child in 2011.
I did, yes.
And what was the experience in terms of the way in which you were cared for at that stage?
To be honest, after all these years, I thought it would have been quite a different experience. But once again, I was put into my own room, my own bathroom, and my everything was put into the hazard bags once again. To me, it hasn't changed.
You lost some blood at that point, and there was a suggestion of giving you a blood transfusion.
Yes, I hemorrhaged and lost 3 pints of blood, and I was told I would need a blood transfusion, at which point I asked, was it life-threatening? And they said, no, it would just speed up my recovery. And I said, in that case, I'm refusing due to pure and simple, I contracted hepatitis C. I don't know what you're putting into me.
Now, in 2012 or thereabouts, you were told that you had grown out of the von Willebrand disease.
Yes, exactly. That was a Friday. I was in the hospital with my son, and I refused to take the blood transfusion. I was told by the doctor leaving that weekend that they would see me on Monday because I still wasn't strong enough to go home. But all of a sudden on Saturday morning I was fit to go home and I was discharged. Then up to it was a year later for my usual appointment into haematology that I was told that I no longer had to come back. I was discharged because I had grew out of von Willebrand's.
And we can see from a letter 96005, please. It says that you had in the past been labelled as having von Willebrand's disease, but as with the proportion of those patients with ageing, the von Willebrand levels have corrected and as such she no longer has the von Willebrand's disease. Your statement suggests a degree of scepticism about whether that's correct.
Very, very much so at this time. I did follow it up with, it was once again that gave me that news, and I asked her, how can I grow out of something that you inherit? And I was told that this has come across now, people with von Willebrand's, yes, can grow out of it. And I said, but von Willebrand's, we were always told by Dr. Main that we had a rare type, that our levels went up and down quite often, that it could be normal 1 minute and be very severe the next minute. And I was told once again that no, they had checked me over a few months and that I was clear off it completely, and so I was just to be treated like any other normal woman. That letter that you're applying to was to a gynecologist, because I need a hysterectomy, and he had told me that I had a 50-50 chance of dying on the table because of all my health problems, and he does not write off that I have von Willebrand's disease, let alone hepatitis C.
Okay. And indeed, although you were told that you'd cleared the hepatitis C virus some years ago, you received more recently in 2013 a call from your GP about it. What can you recall about that?
I had had blood tests done and my GP rang me up and said,
We can redact that, don't worry.
Okay, thank you.
So if you could just stop the live transmission for a moment, because there's a delay. Could you just go back? Thank you. Don't worry.
Apologies, that's all right.
Okay. So, do we start it again now? So don't worry, the transmission was stopped.
It's quite hard not to say your name sometimes.
I can imagine. You're doing very well. We'll start it again in a moment, and we'll pick it up from where we are now.
I don't think I'm going to have any fingers left in here.
Okay, all right. So you were telling us, without mentioning any names, if we can,
I got a
about
phone
your
call
GP.
from my GP asking if that I could come in to see them, and I asked what was wrong, and they said that they had received bloods back saying that I had come up positive for hepatitis C. At that point I responded was, I know I've got hepatitis C, but I'm cleared. And they went, no, it's showing up here.
And has that something that's been resolved further with your GP or with anybody else, or are you still left in a state of uncertainty?
My GP followed out more blood tests and said that it's now showing up, it's not active.
Now, your statement talks about the stigma associated with hepatitis C, and you've used descriptions such as feeling like an outsider, an outcast, a leper. And I wondered if you could tell us really in your own words how it is that the diagnosis has made you feel over the years.
Well, whenever I was diagnosed, I was 21. And this newly married, thought I had a whole life ahead of me. I had a fantastic job with great prospects in it, so I had a very well paid job, and I really enjoyed doing, and just basically looking forward to a fantastic life, and to have that life taken away from you for no reason whatsoever, and especially from no fault of your own. It's very daunting, and having to live with something that you didn't cause, but be treated like it was your fault, and have people look at you like you're basically something out of a jungle book. Going to the dentist and being kept to the last and going into them rooms that's covered in plastic, and you're sitting down there and they're asking for the hazard box to put the stuff into, and drill covers, everything just been covered in plastic. It is so degrading and very soul destroying.
You've received some support in terms of financial assistance from the Skipton Fund. You said in your statement you received a payment of that was the standard payment that was offered, but that you had to drop a case, a legal case that you had been pursuing privately.
Yes, I took out a private case which my mother and father were going to pay, and I had started it whenever I was pregnant, and my medical notes had been sent for, and one of my appointments with Dr. Main commented to me that she had received a letter to get my medical notes, and her answer to me was, "You would better spending your money on getting hypnotised to have an easy birth, because this is something you're never going to win." And then to take the money from the Skipton Fund, I had to sign to say that I would withdraw my own private case to accept the money from it.
And I should just say, Dr. Main has said in her response to your statement, she does recall mentioning hypnotism to you, but her policy was never to discuss litigation with patients, so she's puzzled by that observation. So you dropped your private case at the point at which you accepted the initial payment from the Skipton Fund.
Yes.
You receive a small annual payment for heating from the Skipton Fund, but you didn't find that out directly from the Skipton Fund, as I understand it. How did you find
that out from the Haemophilia magazine.
And you've said in your statement that if you hadn't seen it in the magazine, you wouldn't have known about it and wouldn't have known to make the application to the Skipton Fund.
I'd be stunned on the wiser.
Mazzie, those are the questions I have for you. But is there anything further you'd like to say?
Well, at this point, I would like to thank Sir Brian very much for bringing it to Northern Ireland, for us to have our say, because I feel that we're small over here and we're sometimes not taken into account with the rest of the UK. We contracted it the same as everybody else. We were all treated the same as everybody else. But when it comes to the financial side of it, we're treated totally and utterly different. And I just want to thank you for bringing it to us and letting us have our say.
Mazzie, I'm just going to ask Ms. Gollop, who, as you know, represents you, if there's anything further.
Yes.
Yes, just one point of detail about the conversation that you've related in the corridor with Dr. Main, in which you were told, you've said about having hepatitis C. Was anybody else present with you at the time?
I'm going to be honest and said I was going to staple her mouth closed this whole time, but yes, my mother was with me.
Thank you. Well, we can no doubt ask your mother to provide a statement to the inquiry in due course if she would like to. Thank you. Sir.
Well, you thanked me, but I think really you deserve the thanks of all of us for being prepared and having the courage to sit there and tell us your story. So thank you very much indeed.
Thank you.
We'll take a break till 4:45, and at 4:45 I shall listen to the submissions made by the Health Board.
Thank you, sir.